In 2001, representatives of African nations gathered in Abuja, Nigeria, and signed a declaration that set out a plan for addressing some of Africa's greatest health challenges. The Abuja Declaration included a promise that each government would give at least 15% of the national budget to improving the health sector.
In the years following signature of the Abuja Declaration, Uganda's health expenditures would continue to average less than 9% of the national budget. In those years, Uganda made insufficient progress on the health-related Millennium Development Goals.
Could our insufficient progress be due in part to the fact that Uganda has critical shortage of health workers?
The World Health Organization recommends a minimum of 1 health worker for every 439 people. Despite having many institutions for training health professionals, Uganda has only 1 health worker for every 1,298 people.
When I graduate and become a doctor, for every 8,000 Ugandans, there will only be 1 of me.
And less than half of the 4,200 doctors registered in the country are actually practicing clinical medicine.
You would think that with so few doctors, we would be paid very well.
Not true.
On average, a doctor in the United Kingdom earns 12 times more, while those in Rwanda and Kenya earn 3 or 4 times more than the doctors in Uganda.
Some doctors are not paid at all for long periods.
Which laborer works constantly without pay for 4 months and still goes on for fear of losing a career? This is sheer robbery in broad daylight.
Over the last 10 years, 2,000 Ugandan trained doctors have left the country to seek better paying work.
And it's not just the doctors leaving the country for better employment.
70% of Ugandan nursing students report plans of working outside the country within 5 years of their graduation.
Our country is producing outstanding health workers.
Why can't our people reap the benefits?
Much as you may have all the knowledge, the skills and everything that you've gained from school and experience over time, you're unable to practice because of the limited resources that are on the ground. The impact of insufficient resources, including finances, on the patient outcome is grave. It means loss of lives or outcomes with severe morbidities.
Uganda deserves better.
Health is a human right.
For every
single
Ugandan.
President Museveni.
Prime Minister Rugunda.
Minister Chwanka.
You have said that ensuring quality health care for all Ugandans is a priority for this government.
We do not seek wealth.
We do not desire privilege.
We want every Ugandan to have access to quality health care.
We want to use our skills to save lives in our country.
We want you
to keep your promises,
to honor your agreements,
to be people of your word.
Increase the share of Uganda's budget for the health sector to 15%.